Hey, Crystal, how are you doing?
Oh, not too good, not too good. I've been experiencing these crazy, unusual symptoms the last couple of days.
Oh, really?
Yeah, like, it's been just crazy. Like, now, like, I really have to go to the bathroom, so if you don't mind excusing me, I'll be right back.
Okay.
Sorry about that.
Crystal, are you okay?
I just don't understand why I'm experiencing these crazy symptoms.
Are you experiencing pain or burning when you pee?
Yes.
Are you experiencing any pain or pressure in your lower back or abdomen?
Yes. Yeah, and these, like, I've been having like the urgency to go like crazy, and I don't feel like I'm even emptying my bladder completely. Like, I just don't understand.
I don't know. From what it looks like to me, it seems like you have a UTI.
A UTI?
Yes, and I think you should take Macrobid.
Macrobid is an antibacterial agent specific for urinary tract infections. Macrobid is an antibiotic that fights bacteria in the body. Macrobid is indicated only for the treatment of acute, uncomplicated urinary tract infections caused by susceptible strains of E. coli or Staphylococcus cephalopodeus. To reduce the development of drug-resistant bacteria and maintain the effectiveness of Macrobid and other antimicrobial agents, Macrobid should be only used to treat or prevent infections that are proven or strongly susceptible to be caused by susceptible bacteria. Macrobid lacks the border tissue distribution of other therapeutic agents approved for urinary tract infections. Urine specimens for culture and susceptibility testing should be obtained before and after completion of therapy. The urinary tract infection from the kidneys to the urethral meatus is normally sterile and resistant to bacterial colonization despite frequent contamination of the distal urethra with colonic bacteria. The major defense against UTI is complete emptying of the bladder during urination. About 95% of UTIs occur when bacteria send the urethra to the bladder, and in the case of pylonic nephritis, ascend the urethra to the kidney. Systemic infection can result from UTI, particularly in the elderly. When Macrobid is given in low doses for prophylactic use, the drug has a bacteriostatic effect. Higher concentrations of Macrobid can cause a bactericidal effect, and it is effective against many gram-positive and gram-negative organisms such as E. coli, Staphylococcus aureus, Streptococci, Neisseria, and Klebsiella species. Peak action occurs 30 minutes after absorption. If sudden onset of dyspnea, chest pain, cough, fever, and chills develop, the patient should contact the health provider.
After taking Macrobid, an improvement in symptoms may be noticed within a couple days. However, it is important if the course of Macrobid is finished or the drug continues to be taken for at least 3 days following a clear urine sample. Check with your doctor immediately if any of the following side effects occur while taking Macrobid. More common side effects are changes in facial skin color, chest pain, chills, cough, fever, general feeling of discomfort or illness, hives, hoarseness, itching, joint or muscle pain, shortness of breath, skin rash, sudden trouble in breathing, swelling of the face, mouth, hands, or feet, and trouble breathing. Less common side effects are black tarry stools, blood in the urine or stools, burning, numbness, tingling, or painful sensations, dizziness, drowsiness, headaches, pinpoint red spots on the skin, sore throats, unsteadiness or awkwardness, unusual bleeding or bruising, unusual tiredness or weakness, weakness in the arms, hands, legs, or feet. Treatment of this type of patient carries an increased risk of toxicity because of impaired excretion of the drug. Macrobid is also contraindicated in those patients with known hypersensitivity to Macrobid. You should not take Macrobid if you are allergic to it or if you have severe kidney disease, a history of jaundice, or liver problems caused by taking Macrobid. If you are urinating less than usual or not at all, or if you are in the last 2 weeks of pregnancy.
3 days later.
Oh, hey, Crystal. I meant to ask you how you've been feeling since the last time we met.
I have been feeling 100 times better. 100 times better. I actually see my doctor, and she prescribed the Macrobid like you requested, and the medication works wonders. I seen my symptoms had improved within a couple of days.
That's good.
Yeah, I felt much better. And I made sure I took my medication as prescribed. I took the entire medication. She did tell me that if you don't, your symptoms may come back, so I made sure I took the complete prescription. So yeah, thanks for asking.
Oh, okay.
And thanks for offering that drug. Prescribing Macrobid. Teach patients not to crush tablets or open capsules. Encourage the patient to avoid antacids because they interfere with drug absorption. Teach the patient to shake suspensions well before administration and to protect them from freezing. Warn patients not to drive a motor vehicle or operate dangerous machinery. The drug may cause drowsiness. Inform patients to increase fluids and take the drug with food to minimize GI upset. Alert the patient that the urine may turn a harmful brown color.